Good evening, everyone. I welcome you all to this session today. Today we are conducting 12th session of PRAGNAVARIDHI lecture series. We have Vaidya Sushma ma'am. She will be teaching about Roganutpadaneeya Adhyaya of Ashtanga hridaya Sutrasthana. We'll start the session now. Over to you, ma'am.
Thank you. Thanks a lot. So, uh, today's session it is all about Roganutpadaneeya Adhyaya of Ashtanga hridaya. Similarly, we have same concept has been dealt under Charaka Samhita Sutrasthana under the heading of under the chapter of Navegandharani Adhyaya. Same concepts, but under different chapter, which is named under Roga Anutpadaniya Adhyaya. Okay. See here in Ashtanga Hridaya Sutrasthana, the first chapter was about all introduction and different various concepts of Ayurveda. Right? We understood about Tridosha, Dhatu, Mala, uh, Roga, and Chikitsa, Chatushpada, everything in the first chapter. Next, he explained about Dinacharya and Rutucharya, which has the limitations of time. Like when you read about Dinacharya, there is a limit for that. Like you're supposed to follow it during the daytime, right? In Dinacharya. And when you learn about Ritucharya, there is a time frame again. In every Ritu, you have a particular kind of rules and regulation that has to be followed during that time only, right? So we dealt about the rules and regulations and the Swasthavrita part, which has to be, which can be followed every day, but they have specific time frame. Okay, but here in this chapter, there is no time frame for whatever is explained in this. Though this is also coming under Swasthavritta itself, precaution itself. These concepts do not have any time frame. Okay, so that is the importance of this chapter, which is called Roga Anutpadaniya Adhyaya. So, as the title goes, Roga Anutpadaniya, we will understand what has to be done so that the diseases are not manifesting in the body. Roga Anutpadaniya. Okay, we'll start with the first words. Very, very important shloka. It is better if you by heart this because this whole chapter under the name of Adharaniya Vega can be asked for your long question, 15 mark question, or it could also be a 5 mark question. So it is always better for you to by heart this because there is difference between whatever is explained by Charakacharya and here Vagbhatacharya in the words. There is no major difference about the Vegas or Adharaniya Vegas. They're almost same, but the number varies and the words which are used also varies. So it is very, very important for you to use the same words which are mentioned in the shlokas. So for that, it is better if you by heart this shloka. That is, Vegan na dharayet vata vin mutra kshava trut kshudham nidra kasa shrama shvasa jrumbha ashru chhardi retasam. These are the Vegas that are not supposed to be controlled. Okay. So same, we have seen the same thing. Vata, Vit, Mutra, all of these are the feces, the belching, the flutters, the urination. Kshavathu is sneezing, Trit is thirsty, Kshudha is hunger, Nidra sleeping, Kasa is cough, Shramashvasa is the tiredness what happens after doing lot of work. That is called Shramashvasa or say panting kind. Okay. Then Jrimbha is yawning, Ashru is tears, Chardi is vomiting, Retasam is the sexual desire. So all of these should not be stopped. Next, individual Vegadharana, Lakshanas, and the treatments are explained in the further shlokas. From shloka number 2 until shloka number Mm, yeah. Shloka number 21. Until then, we have different explanations of every single Vegadharana and their treatments. Okay. So, see, if possible, you can by heart all of these shlokas. But if not possible, it is better if you understand the proper wordings, whatever is explained in the shlokas, whatever is mentioned in the shloka. It is always better if you know the wordings properly. Okay. About what happens, the lakshanas of Vegadharana, like what are the symptoms that is caused, or what are the diseases that is caused due to controlling of such urges, and what is the treatment for that. Okay. If it is always better for you to by heart shlokas, if not possible, always try to by heart the specific words. Okay. So here first one is Vata Vatarodha, like Adhovata Vegadharana. That is the Vata which passes down, the flatus. If you control that, what is going to happen? Adhovatasya rodhena Gulma Udavarta Ruk Klamaha Vata Mutra Shakrit Sanga Drishti Agnivadha Hridgadaha. Okay, so here these are the lakshanas, these are the diseases that can be caused due to controlling of adhovata, that is flatus. If a person wants to pass the flatus but he is among uh, in the crowd, if he is outside, if he is worried that it can smell or anything, whenever he stops that, what is going to happen? Either instantaneously or with continuous practice of the same controlling of flatus. What happens is gulma. There is abdominal disorders happening. Udavarta is excuse me. Udavarta is abnormal movements of the intestine. That is udavarta. That could be understood like that. Ruk is pain in the abdominal region. Klama is feeling tired without doing any work. Okay. And then Vata Mutra Shakrit Sanga. There is disturbance in the proper movement of Vata Mutra, that is urine, and there is also this constipation seen. The motions will also be unable to pass in the proper manner. So the passage of all of these three things will get hampered. Vata Mutra Shakrit Sanga. Drishti and Agni Vadha. There is Drishti Vadha, there is Agni Vadha. There is disorders of the eye which can manifest, and there is loss of appetite also. Agni Vadha happens. Hridgadaha, different kinds of Hridroga. Here, Hridroga could be understood as any kind of Hridroga, and also any pain or discomfort in the chest region. Okay, so these are the lakshanas here of Adhovata Vegadharana. Next, we have about Shakrit Vegadharana, that is controlling the Vegas of passing the stools. Shakritaha Pindikodveshta Pratishyaya Shirorujaha Urdhvavayuhu Parikarto Hridayasyoparodhanam Mukhena Vit Pravrittischa Purvoktascha Amayaha Smritaha. Very important shloka. This you will regularly see in your practice once you start. It's very, 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 very common symptoms that we see in most of the patients. Okay. Shakritaha Pindikodveshtam. Pindikodveshta is calf muscle cramps, and Pindikodveshta Pratishyaya, running nose, Shirorucha headache, Urdhva Vayuhu, there is belching, lot of belching which happens. Parikarta is Parikartika, that is fissure, kind of fissure, and it could also be understood as difficulty in passing motions also. Okay. Hridayasyoparodhanam. There is very tightness and discomfort in the chest region. Hridayasyoparodhanam. Mukhena vit pravrittischa. There is a smell of feces through the mouth of the person, because there is urdhva, because the apanavata is getting obstructed from below. There is no place for it to go, and the vit smell, whatever the feces smell is there, that starts coming up through the mouth, is what the author is trying to tell us. Along with all of these rogas, purvoktascha amayaha smritaha, whatever the diseases that have been mentioned earlier, that is when he explains about adhovata vegadharana, all those diseases are also seen in shakrit vegadharana. You understand this? So once there is vata, adhovata vegadharana, there could also be shakrit vegadharana, which is habitual in people. So when shakrit vegadharana happens, the diseases which are also occurring in adhovata vegadharana will also be seen. Very, very important shloka, and if possible, by heart this. Next, we understand about mutra vegadharana. अंगभंगा अश्मरी बस्ति मेड्र वंक्षण वेदनाः मूत्रस्य रोधात् पूर्वे च प्रायो रोगाः. Okay, so here he says again the rogas which can be possibly seen when there is continuous holding of urine. Okay, angabhanga, that is body pain, like stiff kind, and the patient tells there is continuous pain in the body. That is called angabhanga. Ashmari, basti, medra, vankshana, vedanaha. There is possibility of ashmari, that is stone formations. Basti, medra, vankshana, vedanaha. There is pain in all of these regions. There is pain in the basti, bladder. Medra is the genital regions. Vankshana is the inguinal region. All of these places there is continuous pain. And also mutrasya rodhat purvecha prayo rogaha, whatever the earlier symptoms of adhovata vegadharana and shakrit vegadharana rogas are mentioned, those are also seen in mutra vegadharana. Why is this uh, earlier symptoms mentioned? Is because all of these vata, mutra and shakrit are controlled by apanavata. So once there is apanavata, any place in any process, if there is apanavata disturbance, there is disturbance of all the three. That is what the author is trying to tell here. That is why we have seen only lakshanas mentioned and not the treatment, because after this he is trying to tell us the chikitsa. Okay, because everything is related to apanavata itself, everything is related to apanavata rodha itself, vikriti, and vata mutra shakrit sanga, everything is the apanavata functioning is itself getting hampered. The treatment is only for apanavata vikriti, so everything in collective manner he is told in the later form. And similarly the lakshanas are also same, because once there is apanavata vikriti, the whole system or the whole organs which are coming under the control of apanavata will all get hampered. That is what you have to understand. So next in this loka we will see the treatment of the previous वेगधारणा treatments. Okay, तदौषधं वर्ति अभ्यंग अवगाहाश्च स्वेदनं बस्ति कर्म च. All of these treatments are, varti is suppositories kind of, abhyanga is oil massage, and avagaha is immersing the body or the part into any drava dravya or any liquid, for liquid aushadhas, that is called avagaha, immersing in hot liquids or warm liquids. The body is kept immersed, that is called avagaha. And svedana karma and basti karma, all of these are the treatments, basic treatments. And then he also again explains purisha rodhotheshu anyam api asadharan. Okay, that is not this look, I'm sorry. Annapanam cha vidbhedi vitrodhotheshu yakshmasu. Here he is explaining us about vitrodha, that is the first treatment he is explaining here about Purisha Vegadharana. So when there is Purisha Vegadharana Lakshanas, what you have to do is Annapanamcha with Bhedi. So whatever causes Bhedana of the pieces, those has to be done. Vidrodhotheshu. In Vitrodha, all you have to do is give them the food and the liquids which can help the motions to pass down. Okay. Next, he explains about Mutravegadharana treatment, that is Jeeranantikam cha Uttamaya, sorry, Mutrajeshu tu pane cha Pragbhaktam Shasyate Ghritam Jeeranantikam cha Uttamaya Matraya Yochana Dvayam Avapidakam Etacha Sanmitam. Here he is explaining us about Mutravegadharana treatments. So first he explained about Vata Vegadharana, where we saw about Varti, Abhyanga, etc. And the previous shloka was about Shakrit Vegadharana Chikitsa. And now we are learning about Mutra Vegadharana Chikitsa. In Mutra Vegadharana Chikitsa, what you have to do is, this is called Avapidaka Snehana. Okay, this Avapidaka Snehana could be a 2-mark question also, or 3-mark question. A small concept, but very beneficial in the treatment part, and also very, very important for your exams. Avapidaka Snehana. This Avapidaka Snehana is a procedure where, according to the cost of the person, according to Rogabala, Rogibala, patient, the disease, what is his appetite, what is his koshta, everything, after analyzing everything, there is a particular quantity of snehapana, that is uttama matra of sneha. Okay, the maximum amount of ghee or snehana or any kind of sneha that will get digested in 24 hours. Okay, that is divided into 2 parts, and first part is given uh, before food, and the second part is given after the food is digested. So imagine there is 24-hour window period. At 0 hours, the patient takes the first half of the ghee quantity, and then he takes the food, and whenever he feels hungry after eating the food, that is the next time that you give the other half of the ghee, and wait until 24 hours period is over. And by the end of 24 hours, the patient or the person has to feel hungry. So that is the amount of sneha that you will be giving to the patient. This is called avapidaka sneha. Okay, so as soon as this is what is the shloka all about. Mutrajeshutu panecha prag bhaktam, like before food you have to give them half, and again jeeranantikam, after the food is gotten digested properly. So Uttamaya Matraya, in the Uttama Matra of Snehapana, you have to give it twice. So one is before food, one is after digestion. This is called Avapidaka Snehana, and this is the only treatment given for Mutra Vegadharana Chikitsa. Very, very important shloka, Avapidaka Snehana. You could expect this for 2 or 3 mark question. Better if you by heart the shloka. Next we will be seeing about the Udgara Vegadharana. Dharanat punaha Udgarasya aruchihi kampo vibandho hridayo rasoho admana kasa hidmascha hidmavat tatra bheshajam. So here he explains about Udgara Vegadharana. Udgarasya. What happens? Dharanat punaha Udgarasya. If there is controlling of Udgara Vega, what happens is Aruchi, the person will lose the taste of the food. Kampa, there is tremors. Vibandha, there is constipation or malabadhata. Hridayo rasoho, uh, Vibandha in Hridaya and Vibandha in Uras. Here Vibandha does not mean Malabhathata, sorry. Vibandho Hridaya Uras. There is discomfort in Hridaya and Uras. That is what the author means here. Adhmana, there is distension of the abdomen. Kasa, cough. Hidma is hiccups. And the treatment is according to the chikitsa of Hidma or the Hikka Vegadharana Chikitsa. Hidmavat Tatra Bheshajam. So to treat the diseases which have occurred due to Udgara Vegadharana is same as that of Hikka Vegadharana. Okay, and that we will see next. So here this shloka explains about Kshutehe, that is sneezing, the control of sneeze. Shiro arti indriya daurbalyam manyastamba arditam kshutehe. So if the person is continuously trying to hold on his sneeze, what happens is shiro arti. So here arti means pain. Anywhere you see arti, then that is called pain. Okay, so shiro arti or karna or anywhere, any organ with arti is called pain. Okay, so shiro arti is headache. Indriya daurbalya, there is weakness of all the indriyas. Manyastambha is pain in the temporomandibular joint, and ardita, that is facial palsy. All of these diseases are caused due to controlling of Shuddha Vega Dharana. And the chikitsa is Tikshna Dhuma Anjana Agrana Navana Arka Vilokanaihi Pravartayat Kshutim Saktam Snehasvedaucha Shilayet. These are the treatment modalities for reducing the Kshuddha Vega Dharana Lakshanas. That is Tikshna Dhumapana and Anjana, utilization of Anjana. Agrana, that is Tikshna Agrana, is Dhumapana again with utilization of Tikshna Dravyas. That is, uh, any Tikshna Dravyas you have to keep smelling because that will induce uh, sneezing, right? So that is why you're supposed to inhale too much of Tikshna Dhumapana, Tikshna Anjana, Tikshna Agrana, smelling of all of these Tikshna Dravyas. And then Tikshna Navana, that is Nasya in with Tikshna Dravyas, and Arka Vilokana. Arka Vilokana is you have to start looking at the sun. Arka is sun, Vilokana is looking at the sun. So Arka Vilokana is looking at the sun. So the first line says Tikshna Dhuma, Tikshna Anjana, Tikshna Agrana, Tikshna Navana, and Arka Vilokana. Pravartayat Kshutim Saktam. So when all of these are done, it will induce sneezing. Pravartayat Kshutim. And then after that, you have to do Snehana and Svedana properly. So this is the treatment for Kshuddha Vega Dharana. Hope you have understood. Next, he explains Trishna. Okay, what happens when there is Trishna Vega Dharana and the treatment also. Shosha, Angasada, Badhirya, Sammoha, Brahma Hridgadaha, Trishnaya Nigraha Tatra, Sitaha, Sarvo Vidhirhitaha. In 2 lines itself, he is explaining about Trishna Vegadharana and the Chikitsa also. Lakshanas are Shosha, there is dryness of the body. Angasada, there is pain or fatigue kind. Badhirya is unable to hear properly. Sammoha is getting unconscious. Brahma is vertigo or giddiness. Hridgadaha, uh, kind of discomfort in the chest area or upper abdominal area. Hridgadaha, Trishnaya Nigraha Tatra. These are the lakshanas of Trishna Vegadharana. Okay, and then the treatments are Shitaha Sarvo Vidhirhitaha. Any actions or any karmas that is Shita Vidhi, that is utilization of cold water or cool water, not cool water, and taking bath with cool water, intake of cool aharas and panas, everything whatever will cool down the body, Shita Vidhi, everything can be included under the treatment for Trishna Vegadharana Chikitsa. So next is Kshuddha Vegadharana and its Chikitsa. Okay. Angabhanga Aruchi Glani Karshya Shula Brahmaha Kshuddhaha Tatrayojyam Laghu Snigdham Ushnam Alpam Cha Bhojanam. Here he is explaining what happens if Kshuddha Vegadharana has been done continuously or the appetite is not treated properly. Angabhanga, again there is severe body pain. Aruchi, there is loss of taste. Glani is weakness. Aruchi, glani. Karshya is reduction in weight. Shula is pain. Brahmaha is giddiness again. So all of these are the lakshanas of Ksudha Vega Dharana. And the treatment is Tatrayojim Laghu Snigdha Ushna Alpa Bhojana. Laghu is light food. Snigdha is the food which has a little bit of snigdhata or which is processed with sneha, that is snigdha. Ushna, the food should be hot. Alpa, little quantity of food which has all of these qualities of laghu, snigdha and ushna. Little amount of food that is easy to digest, which is hot in nature and which is hot, freshly prepared and hot, and it has little amount of sneha. Such kind of food has to be given as the treatment. Okay, this is all about Ksudha Vegadharana, Lakshanas and Chikitsa. Next, he explains about Nidra Vegadharana, Alasya Jrumbhikaha, Angamardascha Tatreshtaha, Swapasamvahananicha. So until Angamardascha, it is all about the Lakshanas. What happens if there is Nidra Vegadharana, and after that it is about the treatments. Nidraya, if there is a continuous awakening in the night, or if the patient is not sleeping properly at time, is not getting proper amount of sleep, or it is disturbed, or anything, Nidra Vegadharana is happening. What are the Lakshanas is Moha, that is feeling confusion, unable to, what do you say, decipher what he has to do at what point of time, and he's just confused kind. Murdha Akshi Gaurava, there is heaviness in the head and there is heaviness in the eyes. Murdha and Akshi Gaurava. Alasya, he keeps yawning. Alasya is he feels tired, and Jrumbika, he feels yawning, and Angamarta, there is body pain. All of these are the lakshanas. If a person does not get proper sleep, or if he is trying to control the sleep, or if he is not able to sleep properly in the night time. So the treatment is Ishtaha Swapnaha Samvahananicha. He has to uh, take good sleep. That is, sleeping is the treatment here, and Samvahanani is slight kind of not hard massage or deep tissue massages kind, but it is just some caressing massages that can help, or that can be the treatment. Okay, so this is all about Nidra, and next we come to Kasa Vegadharana and Chikitsa of that. Kasasya Rodhat Tadvriddhihi Shwasa Aruchi Hridamayaha Shoshe Hidmacha Karyo Atra Kasaha Sutaram Vidhihi. So this is the only one Vega Dharana which happens to increase when it is controlled. Okay. Kasasya Rodhat Tad Vridhihi. Until now we have never seen in any of the Vegadharanas, in the previous Vegadharanas, Lakshanas, we have never seen that it will increase. If the person is not able to sleep, he does not, the Lakshanas are not about excessive sleeping, right? And if the person is not able, if the person has habitually tried to control his feces, there is no excessive movement of the feces, right? There is no excessive bowel movements. That does not happen. In any of the other Vegadharanas also, we do not see it increasing. But this is the only Vegadharana that increases when suppressed. Okay. Kasasya roga rodhat tad vridhihi. Important question, your Viva question. Okay. You cannot forget this. Shwasa, Aruchi, Hridamayaha. There is Shwasa, that is difficulty in breathing. Aruchi is again tastelessness. Hridamayaha, discomfort in the chest region or the epigastric region. Shoshe, there is emaciation. Hidma is hiccups. These are the lakshanas of Kasa Vegadharana, and the treatment is Kasaha Sutaram Vidhi. Whatever is the treatment for Kasa, same thing has to be done. Next, we see about Shrama Shwasa, Vegadharana, and Chikitsa. Okay, that is Gulma Hridroga Sammohaha Shrama Shwasad Vidharitat Hitam Vishramanam Tatra Vataghnascha Kriyakramaha. So here the lakshanas, whatever is seen, or the vyadhis which can occur due to controlling of shramashwas, or not taking rest as soon as heavy work is done, and whenever the person is feeling like resting for some time and breathing normally also, if he does not do it and he indulges in other work, what happens is gulma, there is abdominal disorders, abdominal swellings, hridroga, any diseases related to the heart, or maybe sometimes even uh, just simple uh, discomfort in the chest region, or sometimes even any cardiac related issues also. Sammohaha is confusion. These are the only three diseases that happens due to controlling of shramashwasa, or excessive breathing after work. Okay, then the treatment is Vataghnascha Kriya Kramaha. All the kriyas, or all the treatments that will do Vataharana is utilized in this treatment. Next, we understand about Jrumbha Vegadharana and its chikitsa. Jrumbhayaha Kshavavadrogaha Sarvascha Anilajid Vidhihi. Sarva Sarvascha Anilajit Vidhihi. Sorry. So here, very simple. What happens when there is Jrumbha Vegadharana is Kshavavad Rogaha, that is Kshavathu. We saw about what happens when there is Kshavathu Vegadharana, that is in the shloka number 9. We saw about Shiro, Arti, Indriya Daurbalya, etc. These are the same lakshanas which are seen in Jrumbha Vegadharana also. So treatment is Anilajit Vidhi, that is Vatagna treatments, Vatahara treatments, Ahara, Vihara, and Aushadhi, which will cause Vata Shamana, that is has to be used. Next, we see about Bashpa Vegadharana, Chikitsa, and Lakshanas and Chikitsa. That is Pinasa, Akshi, Shiro, Hrid, Ruk, Manyastambha, Aruchi, Brahmaha, Sa Gulma, Bashpataha Tatra, Swapno Madhyam, Priyaha Kathaha. Here he says the diseases that can occur due to controlling of Bashpa. Here Bashpa is cry. It could be either because of happiness or because of sadness, either of the situations. The lakshanas, what can uh, be seen due to Ashruvegadharana is Pinasa, Akshi, Shiro, Hrit, Ruk. Pinasa is running nose. Akshi, Shiro, Hridruk. Akshi is eye pains. Akshiruk, Shiroruk, that is headache. And Hridruk, like there is discomfort in the chest region. Manyastambha is temporomandibular joint stiffness. Aruchi, tastelessness. And Brahmaha is giddiness. All of these are the lakshanas. Also, Sagulma, there is abdominal growths also, abdominal distension also that can happen due to controlling of Bashpa Vegadharana. The treatment is Swapno, that is to sleep, Madhyam, intake of alcoholic preparations, Priyaha Kathaha, soothing words or comforting words. Okay, so this is all about Bashpa Vegadharana and its chikitsa. Now we are seeing about Chardi Vegadharana and its chikitsa. The lakshanas are Visarpa, Kotha, Kushtha, Akshi, Kandu, Pandu, Amayajwaraha, Sa Kasa, Shwasa, Hrillasa, Vyangha, Shvayathave, Vamehe. So these are the lakshanas of Vamana Vegadharana. He says there is diseases of Visarpa, a skin disorder. Kotha, a kind of skin disorder, could be like an urticaria. Kushta is all kinds of skin disorders. Akshikandu, Akshi Amaya here. It is eye disorders. Kandu is itching. Pandu is anemic conditions. And Jwara, fever. Sakasa, there is cough also. Shwasa, there is difficulty in breathing. Hrilasa is nauseating feeling, continuous feeling of vomiting. Hrilasa. Vyanga, that is one of the skin condition where there is whitish discoloration of the skin. And Shvayathu, that is swelling. These are the lakshanas of Vamana Vegadharana or Chhardi Vegadharana. If the person wants to vomit but he is stopping it, these are the diseases that he can face in the future days or in future times. The treatments are Gandusha, Dhuman, Ahara, Ruksham, Bhuktva, Tadudvamaha, Vyayamaha, Sritirasrasya, Shastam, Chatra, Virechanam, Sakshara Lavanam Tailam, Abhyangartham cha Shasyate. So these are the treatments explained. Gandusha is gargling, Dhumapana, Kandusha, Dhuma, that is Dhumapana, and Anahara, Dhuma, Anahara. Anahara is fasting or not taking any food. Okay, that is Anahara. Ruksham Bhuktva Tadudvamaha, like the person has to eat any drying foods and again vomit out. Okay, and then Vyayamaha, that is exercise. Srutihi, Srutirasrasya, that is bloodletting. Asra Sruti, bloodletting. Okay, or Raktamokshana, you can consider it as Srutihi Asrasya, that is Raktamokshana treatments. Cha Atra Virechanam. Virechana could also be one of the line of treatment. Sakshara Lavanam, Tailam, the Taila which is prepared of Kshara and Lavana. This has to be used for Abhyanga. Sakshara Lavanam Tailam, Abhyangartham cha Shasyate. Abhyanga has to be done with Taila which is prepared along with Kshara and Lavana. These are the treatments for Chhardi Vegadharana Chikitsa. Okay. Next, we come to the last one, that is Shukra Vegadharana. Lakshanas Shukra Tat Sravanam Guhya Vedanaha Shvayathu Jvaraha Hridyatha Mutra Sanga Angabhanga Vridhi Ashma Shandataha. These are the lakshanas of controlling Shukra Vegadharana. Shukra Tat Sravanam. There is excessive Sravana of the Shukra, that is excessive amount of ejaculation of the seminal regions or the seminal fluids. Then Guhya Vedana, there is pain in the genital region. Shvayathu, there could be swelling. Jvara, fever. Hridyatha, there is discomfort in the Hridaya Bhaga or the chest region. Hridyatha. Mutra Sanga, there is blockage in the normal flow of urine. Mutra Sanga. Angabhanga, body pain. Vridhi. Here, Vridhi is not increased amount of Shukra. Here, Vridhi means hydrocele or disorder related to the testicles. Okay. Here, Vridhi does not mean increased Shukra Sravana. Vridhi here means hydrocele or a disease which is related to the testicles. Okay. Ashma is stone formations either in the kidney or in the prostate gland or at any place wherever the stone can form in the urinary system. Shandataha, impotency. These are the lakshanas of Shukra Vegadharana. This is applicable for both males and females according to the symptoms and conditions. Next, Chikitsa. Shukra Vegadharana Chikitsa is Tamrachuda Surashali Basti Abhyanga Avagahanam Basti Shuddhikaraihi Siddham bhajet kshiram priyaha striyaha. So here he says tamrachuda is chicken. Intake of tamrachuda is what he expects. Sorry. Intake of tamrachuda, that is chicken. Intake of sura, a kind of alcoholic preparation, sura. And shali. Here shali is shashtika shali. Intake of all of these foods. Basti, doing treatments of basti. Basti chikitsa. Abhyanga, body massage. Avagaha is immersion of the body in warm aushadha dravyas. And basti shuddhikaraihi siddham. And aushadha and basti shuddhikaraihi siddham bhajet kshiram. So here milk prepared or processed with the aushadhas which will cause basti shuddhi or bladder clearance. Okay, so there are aushadhas which will help in clearing the contents of the basti. So those medicines has to be used and prepared into milk, and that has to be taken, and the person has to involve in sexual activities with the woman he loves. Priyaha, striyaha. So overall, there is ahara, which is told tamrachuda, sura and shali intake. Treatment as basti, abhyanga and avagaha, and also an aushadha dravya, which is kshira prepared with basti shuddhikara aushadhas. And vihara, he explains about priyaha, striyaha. He has to stay with people or women with whom the person is loving. Next, he explains Truchulartham Tyajet Kshinam Vidvamam Vega Rodhinam. So the person, whenever a person comes to you who expresses that he is having trut and shulartham, such person, the person who is suffering with excessive thirstiness, has to give up the Vegadharana of Vit, Vamana, these two Vegadharanas. So if a person is having excessive thirstiness and continuous pain in the body, then you have to check for continuous habitual controlling of vid and vamana vegadharana. If the person, you have to check if the person is continuously doing vid vegadharana and vamana vegadharana. Okay, one important point which is being mentioned. Next he says rogaha sarvepi jayanti. So here now he is explaining about what. So until now we have seen what are the vegadharana lakshanas and chikitsa, right? Now he is giving us a gross information and the other implied aspects of vegadharana and treatments of that, and what happens, how it happens, what are the adverse effects of doing all of these vegadharana. He says rogaha sarvepi jayante vega udirana dharanaihi. Very important shloka. So here he is saying all the rogas occur due to vegadharana or vega udirana. Vegadharana is controlling the forces or the natural urges which have been started, or udirana is to forcefully do or forcefully exert pressure to get the vegas. Okay, even if the person does not have the feeling of passing the motions, passing the bowels, if he's trying to forcefully evacuate that, that is called vega udirana. So all the diseases occur due to vegadharana and udirana. Very important shloka. Next he explains about निर्दिष्टं साधनं तत्र भूयिष्ठं ये तु तान् प्रति ततश्च अनेकथा प्रायः पवनो यत् प्रकुप्यति अन्नपान औषधं तस्य युञ्जीता तो अनुलोमनम. So here he's telling the gross samprapti, what can happen due to Vegadharana. Okay. So earlier he said, in the previous sloka, he said that all rogas occur due to Vegadharana and Udirana only. So when such things happen, what is the treatment and how is the treatment going to be planned? What is the samprapti? Nirdishtam sadhanam. The treatment is bhuishtim yetu tan prati. Whatever is being stopped doing the same thing is the treatment. Okay. Tatascha anekadha prayah. There are different varieties of treatment also. Prayah pavano yat prakupyati. There is increased vata. There is a vata prakopa which is happening due to these kind of vegadharana and udirana. There is vata prakopa. So when there is vata prakopa, what you have to do is annapana aushadham tasya yunjitat and anulomanam. So whatever the annapana and aushadha is reducing the vata prakopa, those things you have to do, and you have to start utilizing excuse me, you have to start utilizing anulomaka dravyas, anulomaka, annapana and aushadha, and vatahara, annapana and aushadha. So first line of treatment is asking them to do whatever they have been controlling. Like if they are controlling vata vegadharana, if they're doing, ask them to stop that. That is the first line of treatment. And then even if they are doing it continuously, excuse me, there will be vata prakopa in the body. So for that you have to utilize anulomana dravyas and anapana aushadha, which will cause vata shamana. Next we are looking at dharaniya vegas. Okay. So next we are looking at the dharaniya vegas, where he says dharayetu sada vegan hitaishi pretya chehacha lobha irshya dvesha matsarya ragadinam jitendriyaha. Until now, all of the discussions were about adharaniya vegas, or the vegas that has to be not controlled. Now he explains what has to be controlled. Okay, that is lobha, irshya, dvesha, matsarya, ragadi. Other disorders, that is lobha is excessive greediness, irshya is jealousy or envying, dvesha is hatredness, matsarya is again kind of jealousy, raga is attachment, and other adinam, the etc. other such behaviors, and jitendriyaha, and should always do jitendriya. He should always have control over his indriyas, that is sense organs. Okay. Next, he explains that yathetha cha yathakalam malanam shodhanam prati atyartha sanchitaste hi kruddhaha syuhu jivita chidaha. So now he is telling yathetha cha yathakalam. He is telling that according to the season, according to the time, there should be mala shodhana happening inside the body, that is detoxification kind of processes. So there is seasonally there is dosha sanchaya prakopa happening, that has to come down, that has to be treated. Those prakupita doshas have to be taken out of the body, that mala shodhana has to happen. If not, atyartha sanchitastehi, if they are getting accumulated continuously or in excessive quantity, then syuhu jivita chidaha, that is uh, it will be kind of it will act as hampering the lifespan of the person. Okay. So seasonal dosha shamana or dosha shodhana, mala shodhana has to happen. If not, in excessive quantity, if they are getting accumulated in the body, they'll increase and they'll cause problems to the jivita itself, the body itself. Next he says, doshaha kadachit kupyanti jita langhana pachanaihi ye tu samshodhanaihi shuddha na tesham punarudbhavaha. How you can control your body to not end up in any roga? Here is the answer. Doshaha kadachit kupyanti. The doshas, no, they will always keep on increasing according to the season. Doshaha kadachit kupyanti. This kupita doshas, increased doshas in the body, has to be controlled. Jita has to be controlled using langhana and pachana kind of treatments. Langhana, that is fasting, and pachana is dosha pachana, that is if the doshas are increased, it has to get decreased by utilizing bhutagni, increasing the bhutagni, then there is pachana happening. That is the meaning here. Langhana pachanaihi means yetu samshodhanaihi shuddha. So if the prakupita doshas are taken care in langhana and pachana itself, okay. But if not, at least you have to do samshodhana. Okay, so initially if the quantity is less and the dosha samana can happen with simple langhana and pachana, okay. If not, if there is increased amount of dosha sanchaya or prakopa, then you have to do shodhana. If you don't control the kupita doshas either with langhana pachana or shodhana, then there is disease occurring. And if you do, na tesham punarudbhavaha, the diseases will not come to such a person. If you don't want any roga manifestations in the body, you have to control the prakupita doshas by using langhana pachana and in some cases shodhana also. Next he tells, यथाक्रमं यथायोगम् अत ऊर्ध्वं प्रयोजयेत् रसायनानि सिद्धानि वृश्य योगांश्च कालवित्. After undergoing the proper procedures of previously mentioned excuse me, after following the proper procedures of previously explained shodhana, I mean shamana and shodhana, what you have to do is follow proper rasayana and vrishya yoga according to the kala, according to the season. So after doing shodhana, you cannot let the patient go. Like, you cannot tell them, oh, your shodhana is done and you can go. Always you have to give them rasayana and vrishya yogas. That is how the panchakarma ends. That is when there is no roga udbhava. Okay. Next he explains, भेषज क्षपिते पथ्यम आहारैः बृंहणं क्रमात् शाली षष्टिक गोधूम मुद्ग मांस घृतादिभिः हृदय दीपन भैषज्य संयोगाद रुचि पक्तिदैः स अभ्यंग उद्वर्तन स्नान निरूह स्नेह बस्तिभिः. These are the therapeutic procedures or the panchakarma procedures which are supposed to be followed for not manifesting any vyadhis. Bheshach shapite pathyam aharehi brahmanam kramat. After undergoing, like he told that after panchakarma, a person has to undergo rasayana and vrishya yogas, right? So what is that? He is explaining here. Pathya ahara and brahmana. Brahmana also has to be done. And the foods and everything, whatever has to be done is shali, shashtika, godhuma, mudga mamsa, grita formulations has to be used. Hridaya, like the food which is pleasing has to be taken. Deepana, carminative. Bhaisajya, the medicines which will cause hridaya and deepana has to be taken. Samyogad ruchi paktidaihi, the aushadhas which will increase the taste of the food and which is carminative. Those aushadhas has to be used. Sa abhyanga. Abhyanga also has to be followed. Udvartana, snana, niruhavasti, and snehabasti. All of the procedures can be followed as a treatment protocol. Okay. So these are the treatment protocols which are supposed to be followed by the patients who are bheshaja kshapita, that is, who have underwent uh, increased amount of shodhana or emaciation or exhaustion after the shodhanas. Okay, so now he is telling the benefits of undergoing shodhana. Tathasa labhate sharma sarva pavaka patavam dhi varna indriya vaimalyam vrishatam dairghyam ayushaha. These are the benefits of undergoing shodhana according to the season. That is, tathasa labhate sharma. Sharma is happiness. Sarva pavaka patavam. That is, sarva pavaka is all levels of Agni will be increased normally, or it will start functioning normally. And then Dhi Varna Indriya Vaimalyam. There is clarity in the intellect, there is clarity in the skin complexion, there is clarity in all the functioning of Indriyas, and there is clarity in the skin also. Vrishata is the person will end up having proper aphrodisiac qualities, and Dairghyam Ayushaha, that is Dirgha Ayusha, increased lifespan. These are the benefits of undergoing proper shodhana and also following proper rasayana and vrishya yogas after shodhana properly. Okay, so here he is also explaining about agantu vyadhis, agantuja vyadhis. Until now, we have seen about vyadhis which have been occurring due to increased vata in the body or due to any vegadharana, right? Those are all the nija vyadhis which are occurring from internal itself. Here he is also again now after explaining all of these nija vyadhis, he is explaining about agantuja vyadhi. He is explaining here about all agantu vyadhis. He says, ये भूत विषा वायु अग्नि क्षत भंगादि संभवाः राग द्वेष भयाद्याश्च ते स्युः आगन्तवो गदाः. What are the agantuja vyadhis, and the causative factors of agantu vyadhis are bhuta, any kinds of foreign particles, visha is poisonous uh, ingredients, vayu is polluted air, agni fire, kshata is any kind of physical trauma or trauma basically, bhanga is any kind of fracture, bhanga adi sambhavaha, raga dvesa bhayadyascha, raga and dvesa bhaya etc. All of these are also causative factor of agantuja vyadhis. Okay, so the agantuja vyadhi karanas is explained here in sloka number 31. Next, treatments of such agantuja vyadhi is त्यागः प्रज्ञापराधानाम् इन्द्रियोपशमः स्मृतिः देशकाल आत्मविज्ञानं सद्वृत्तस्य अनुवर्तनम् अथर्वविहिता शान्तिः प्रतिकूलग्रहार्चनं भूताद्य स्पर्शनोपायो निर्दिष्टश्च पृथक् पृथक् अनुपत्यै समासेन विधिरेषः प्रदर्शितः निज आगन्तुविकाराणाम् उत्पन्नानां च शान्तये. So, see, basically, here what he is explaining is about how you have to, what are the things that you have to follow to not end up in any vyadhi. Okay. He says, Tyagaha prajnaparadhanam. So, you have to discard, you have to avoid any prajnaparadhas, that is, in committing mistakes, even knowing that it is a mistake. Okay, that is prajnaparadha. In Charaka Samhita, we have understood what is Prajnaparadha. So, Prajnaparadha can be of three types, that is, Kaya, Vacha, and Manas. All of the three Prajnaparadhas has to be under control. Indriya Upashama, having control over the Indriyas, that is, not doing Ayoga, Atyoga, or Mithya Yoga of Indriyas, has to be done. Smritihi is having proper knowledge of what has to be done and related to Desha, Kala, Atma Vijnana. Knowledge of the Desha in which the person is staying, Kala, the seasonal uh, things, the day and night things, the Vyadhi related uh, Kalas, everything, and Atma Vijnana about what the person is feeling on his own. Atma Vijnana, Desha, Kala, Atma Vijnanam. All of these knowledge has to be there and actions has to be with respect to these knowledge. Also, the person has to follow Sadvritta and then Atharva Vihita Shantihi. He has to follow whatever the rules and regulations are explained in Atharva Veda, Atharva Vihita Shantihi, Pratikula Graharchanam. He has to follow Graha Archana, etc. Bhutadi Sparshanopayo, Nirdishtascha Pratak Pratak, all of these are spiritual practices. Anupatyaihi Samasena, Vidhireshaha Pradarshita. So, if a person follows all of these, then there is Anutpatti of any Vyadhi. Nija Agantha Vikaranam, Utpannanam cha Shantaye. Even if there is any Vyadhi that is already there, that will also get reduced. And whatever is supposed to get manifested in the future, that will also be under control by following all of these. This could be your important shloka from like the shloka number 32. Tyagaha prajnaparadhanam indriyopashamah smritihi deshakalaatma vijnanam sadvritasya anuvartanam. This shloka is very, very important. If you by heart this, you can write this under Vyadhi Anutpatikara Chikitsa also. Okay. Next, he explains Shitodbhavam Doshachayam Vasante Vishodhanam Grishmaja Abhrakale Ghanatyaya Varshikam Ashu Samyak Prapnoti Rogan Rutujanna Jatu. Here he is explaining Shodhana Kala, that is Panchakarma, what and whatever seasons has to be done according to the Rutu. Okay. This is the shloka about that. The kala during which panchakarma has to be done according to Rutu. This we have already dealt in Rutucharya. So let us move on to the next. Hita Ahara Vihara Sevana. The shloka is also very important. Nityam Hita Ahara Vihara Sevi Samikshakari Vishayeshu Asaktaha Data Samaha Satyaparaha Ksamavan Aptopasevicha Bhavati Arogaha. So this is one good shloka that you can by heart and utilize wherever possible when the question is about Roganutpadaneeya Chikitsa and what do you say? All of these Vegadharana Chikitsas and Adharaniya Vega, Dharaniya Vega, everywhere. And you can also explain this during Sadvritta explanation also. Nityam Hita Ahara Vihara Sevi. Every day, if a person is following Hita Ahara, like good practices of food and activities, Hita Ahara Vihara Sevi, Samikshyakari, if he knows whatever he is doing and then he is doing the things, Vishayeshu Asaktaha. Vishaya is Indriya Vishaya here. If the person does not do Ati Yoga, of Indriya Vishayeshu Asaktaha. He is not interested in too much, he is not indulging too much in the Indriya Vishayas. Data Samaha, his data, he always wants to give away things. Samaha is he takes good and bad things in the proper way, in equal way. Satyaparaha is always for the truth. Kshamavan is always forgiving. Aptopasevi, he always understands the words of Apta. Aptopasevi cha bhavati arogaha. All of these uh, a person who follows all of these will not end up in any vyadhi, is what the author concisely says. Very, very important shloka. So, by this shloka, we are ending the chapter of Roganutpadaneeya Adhyaya. So, this in this whole chapter, we have dealt about Adharaniya Vega, Dharaniya Vega, and the benefits of following Hita, Ahara, and Vihara. What is the Shodhana procedure? Shodhana Kala, we have understood. What is the post Shodhana treatments or post Shodhana Ahara Viharas also? That also we have seen in this chapter. So, kind of important chapter, because theoretically, for your exam purpose, yes, it may carry around 10 marks, 10 to 15 mark question maximum. But practically, when you see for your clinical inputs, very, very important, because most of the patients do have vata prakopa, because they follow all Vega Dharana and they do not do Dharana of Dharaniya Vegas, and they do Dharana of Adharaniya Vegas. Okay, so important chapter by heart, very, very important shlokas, and we will meet tomorrow. Thank you.
Thank you, ma'am. Thank you so much for the session. We'll wind up the session, ma'am.
Thank you.